I think when 110 passed, I think we all know what the crux of or the hope that would happen is they'd have the treatment in place and in line with the removal of the criminality of it. It's still a violation, which is like a traffic ticket. But I think what we've seen since the passage is that the failure for detox facilities, for treatment beds to open up, which has exacerbated the problem. When we don't have the carrot, so to speak, to get people into that treatment, I think ballot measure 110 has fallen woefully short of expectations from the people that voted for it. And certainly, I think it's failed our communities right now in that I think it's becoming increasingly common that we're seeing overdose deaths, overdoses of many types of drugs, but more along the lines of the fentanyl, the opioid crisis that we're seeing right now. That has been exacerbated, in my opinion. Those issues were going on before the passage of Measure 110, but certainly 110 has contributed, I think, to the situations that not only our city's seeing, but both regionally and then statewide.
I would agree with the chief. I think they should have had, the idea was great, but the treatment and the detoxes and the aftercare, it would have been great if that was set up beforehand, and then this would have gone a lot smoother.
Was my understanding when ballot measure 110 was put into effect that there were to be statewide in every county detoxes and treatment centers to become available with the funding that was being provided. Well, we currently, it's kind of a repeat phrase that we hear, the service gaps. I don't feel that it's so much service gaps as complete service unavailability. We have many, many agencies that we partner with that offer the certain kind of help that they can, that they're funded to be able to provide people with. What we're lacking in is detox and inpatient treatment facilities that we just don't have access to, and especially if somebody is on public insurance, that eliminates 90% of their options for detox and treatment, because the vast majority of detox and treatment in Oregon will only accept private insurance.
Oh, wow.
Yeah, so it's a challenge in that that when we do get somebody into detox, the aftercare plan, there is a wide gap in time for them to get back onto the street, whether they're unhoused, and you know, the detox part of it is great. It gets them the initial jump into recovery, and then it's that span before the actual inpatient treatment where we see many people fail because there's just too long of a span of time in between the detox and the treatment for them to be, you know, returning to their old behaviors. I mean, there are many options for outpatient treatment, but it's the inpatient treatment where there's a higher level of accountability. They're not allowed to leave for a certain period of time, which, you know, eliminates a big opportunity for them to relapse and slip back into the addictive behaviors. That's just not available to them. Last I heard is the 2022 numbers we were near last in availability for treatment, and now I think we're in the 50th spot, if I'm not mistaken.
First of all, I think with the passage of 110, I want to keep going back to 110 in that the public consumption of narcotics, specifically fentanyl, the hard drugs, with the passage of 110, it gutted the portion of the law that would make it illegal to use within the public setting, right? I do think that there's going to be some work in Salem in the short session in February that will probably assist in getting that back into the criminal realm, but that certainly has made it the drug widely available. It's almost seen as okay to use in public. I think more along the lines of when we talk about harm reduction and getting people out of the cycle, we're not mutually exclusive. I think we need to work hand in hand with Provoking Hope and our other partners to have those wraparound services. But when we cannot get people into custody, into the jail, into some sort of an accountability, that's where we're seeing just the chronic repeat offenders, the people that are overdosing multiple times, just the chronic cyclical issues that we're seeing in our community, whether it's up on Marsh Lane, Dustin, or any neighborhood for that matter. I think it's it's extremely frustrating for the police, in that we're not seeing any sort of carrot to get them into the treatment and then ultimately see themselves having a successful, healthy life. You bet. And in fact, we had a meeting with Provoking Hope, Jennifer and Aaron, earlier this week, and this topic did come up. There still is drug courts, but the level of accountability, or the people that are in this program right now, it's few and far between. First of all, there's really the impetus of drug court was to get people in at the lowest level, like the first or second time offenders, ones that didn't have multiple arrests, and they saw success in getting them into these programs. And Aaron and I were discussing that. Now we're seeing within the drug court is you're seeing fewer people participating because they're more of the hardcore, I'd say, drug users or drug abusers, and their criminality level doesn't necessarily lend them into finding success within the drug court system. So earlier on, prior to 110, I would say, before the legalization, for lack of a better term, we were seeing people that were just starting to see themselves or enter the judicial system at first, second time, and they were getting them into those courts and seeing some positive results there. Now it's, as Aaron's mentioned earlier this week, we're seeing fewer participants, and I don't know how successful those courts are right now.
Yeah, from what we've seen, prior to Measure 110, it was having the drug charges that would be the catalyst to get you into the drug court system, to have the meeting with the judge and to get accepted into the program. Well, when there's no charges on the personal use amount, then it's really tough to get somebody into the drug court program. So it's the people who are getting charged with more than personal use amounts, distribution, that sort of thing, that are landing in the drug court system, rather than just the person who is a substance abuser.
Aaron, do you feel that the drug court system was an effective tool prior to Measure 110, and do you think it could be again with some changes?
I believe so. I also believe that it really depends on the individual, if they're ready to be held accountable and they're ready to follow the guidelines, and then they're going to be successful. If it's an individual who is deep in their addiction and they haven't reached that point yet where they realize their life needs to change, there's really not a system or a program they're going to be placed in where they are going to be successful. You can't force somebody who does not want to stop using drugs to stop using drugs.
I think it's drastically increased. That's the big drug out there now, and most of the time I'm going to the hospital these days, it's fentanyl.
Mm-hmm. And Aaron, do you have any?
Oh, absolutely. A little bit about my background. I'm an addict in long-term recovery myself. My drug of choice was speedballs, which is a combination of cocaine and heroin. So I was addicted to heavy-duty opioids for a good portion of my life. Fortunately, when the fentanyl wave first started to hit was when I found my recovery. I've been able to maintain my recovery for almost 5 years now, and in the time I've seen people that I used to use heroin with have to switch to the fentanyl because the heroin just isn't available anymore. And the half-life, or the duration of efficacy for the opioid in your system with fentanyl, is up to 50 times stronger than morphine, which morphine is about 10 times stronger than heroin, so it's about 5 times stronger than heroin. It's measured in micrograms, but those micrograms will kill you. And the duration is so short that when people were using heroin, you could use once a day, every 24 hours, because the half-life of heroin is 22 to 24 hours. With fentanyl, it's 6 to 8 hours. So they are so immersed in that addictive lifestyle, chasing it, finding money for it, committing the crime to get it, using it, nodding out, whatever they may be doing when they're in that lifestyle. They're so immersed in it these days that we don't really see a lot of the fentanyl users actually engaging in treatment and things like that, because they are so caught up. I recall that in my addiction days, we would see people, I'm going to rehab, I'm going to treatment, and they would get out of detox and they would maintain a little bit of recovery, and off they went to treatment. With the fentanyl, you just don't see that, because you absolutely must have it. And if you think about it, if it's 5 times stronger than heroin and the duration is shorter, then you could probably calculate that it's about 10 times more addictive than heroin. So it's like throwing rocks at a tidal wave, trying to battle this epidemic. My team is out there every day, making the rounds. You know, we go to where we know that the users are congregating because they're, you know, doing their business and they don't come see us, so we go see them. And we just don't have the successes with treatment that we did with other opioids by any means.
Chief?
I would say, well, obviously we've seen an uptick in crime related to this, the theft. I think our officers would tell you that going out to just the behavioral issues in these drug encampments where people are using is really a service drain to our city and our police department. I think we've seen an uptick in those that are houseless. We've seen that as really a driver of getting them to get out of that cycle, and finding stable or transitional housing has been really difficult. That's when we're seeing the same people over and over again, like Aaron and Jennifer are saying. We have to fix some things, candidly, Sal, I think, within the system before we're going to see any sort of turnaround in what our communities are experiencing. It's just not McMinnville. I mean, you know that I talk with a lot of chiefs around the state. I'm the president right now of OACP. I've been up and down the valley talking to different agencies, different department heads that are chiefs, county sheriffs, and everybody is experiencing this at a level that they've never seen before, and it will not get better until there's some systematic changes going on, whether it's in detox, treatment, housing, the criminal justice system, the accountability piece. I think, honestly, it really needs to be put back into play if we're going to see some change in our communities.
Well, that's a good segue into my next question, which is that the Oregon legislature is coming up on a short session in February, and this is the main topic that they're going to be addressing. So starting with you, Chief Scales, what do you see, and what does your association and the local police see as needed changes to Measure 110 in order to start moving Oregon into a better trajectory?
I think it's probably as short of a complete repeal. I think what we'll see, and I do know that there's going to be bipartisan agreement going in because it's only, 30, 40 days in this short session, so stuff's going to have to be worked out as we go in. But I do see hope on the horizon. I've seen some discussion. I've been a part of some discussions with those in the legislature that have already talked about recriminalizing public use, not knowing if it's going to be an A to C misdemeanor. That's still under debate, but I think there is some hope for that, and I do think that will probably get resolved if we can get this on the table and discuss and sort of resolved right off the bat. And then to your second, and then secondly, I do think from a chief's perspective, the recriminalization of it is an important piece. I want to counter that, though. It's just not recriminalization, because if you talk to DA Barry, for years his office was going through the referrals, like they would get into treatment, or they would start these programs, and his office would dismiss those charges. So that's what the chiefs see. They don't see it as a punitive. They don't want to see people spending time in jail for just the simple possession or simple use of it. I don't think that Sheriff Elliott right now would want people detoxing in his facility. That's not where people need the help. What they need help in is getting them into the cycle to get that treatment. And candidly, the only way we're going to get people successfully into that, in my opinion, is in the criminal justice system, is to have that carrot and then have the stick out there that says, please work with us. We want to get you the help and see you healthy.
So a lot of people might be familiar with how the police deal with, say, a crime like driving under the influence. Mm-hmm. How does the current legal framework around drug use and drug possession, how does that compare to, say, driving under the influence of alcohol?
Possession of certain quantities of hard drugs are now, they are criminalized, but it's a significant amount of quantity. It's just not user. So you're going to get, if one of our officers was to find you with fentanyl, a certain amount, or methamphetamine or cocaine, heroin, whatever it might be, you're going to get basically a citation, a traffic ticket for a violation. That violation is going to be given to you. You're also going to get a number that says this ticket will be dismissed if you call Lines for Life and do basically a screening with them. Now, I will tell you, statewide, less than 10% of anybody that has received those citations, the violation, have followed through with any sort of treatment or even calls. What happens is they'll get that citation, they'll get an appearance that they'll have to show up in municipal court or circuit court, and people are just not showing up. And so there is zero accountability right now. So to your question, you have significantly more consequences getting a DUI than you are with simple possession.
Personally, I would hope to see reform and not repeal. As somebody who experienced difficulty finding a place to live and finding gainful employment after I did get clean, being a multiple felon just because of drug possession, I don't believe that people should have to struggle the rest of their life because they spend a period of their life abusing substances. I think it's part of the human condition not to want to feel pain and trauma and suffering, and these substances provide a respite for people who are basically suffering. They're self-medicating, whatever the issue may be, whether it's mental or emotional or physical even. That's how I became an opioid addict, was through pain medication. I don't think that anybody out there who's using even fentanyl right now couldn't be exactly where I am today should they want it, and should they put a little bit of effort forth to be there. Anybody can do it. It's just a matter of figuring it out for yourself and getting there. So I would like to see some reform in a sense that fentanyl was never meant to be an illicit street drug. It is a very, very extremely dangerous pharmaceutical that was originally designed for end-of-life care for HIV and cancer and things like that, and was never, ever, ever meant to be a prescribable pharmaceutical outside of that and major surgeries. So I would like to see fentanyl be completely removed from the M110 ballot, because it is not a street drug. It is a pharmaceutical that was never meant to be distributed in this manner. I would also like to see folks put a little bit more emphasis on the education piece of it. I feel like there's also a lot of stigma out there. Drug users are dirty. They're spreading the disease, and that's where the programs I manage come in with the harm reduction and things like that. But I would like to see the education be more emphasized. So maybe it would relieve a little bit of the negative self-image that the people who use substances have due to the way that society views them. I'd like to see the education broaden the stigma reduction part. I think there needs to be some sort of incentive for society as a whole to know that this isn't just going to be a slap on the wrist, or that contact with law enforcement isn't going to be me leaving with my dangerous drugs to go and overdose in a tent and die somewhere. There should be some kind of culpability involved.
Jennifer, any thoughts?
I agree with both of them, the reform and the repeal as well. I can go either way. My big thing is I'm hoping for more resources to help make my job easier to help these people get out of their rock bottom. Because like I said, I get them into detox, and then they don't have housing, they don't have treatment, and they just go right back out, and then I'm working with them again. So I would like to see some kind of, like the chief said, some kind of carrot dangling to give them that hope and get them into some kind of treatment.
Thanks.
Where there's no gaps in that service.
Yeah.
Right. There's no way to incentivize it right now.
There's no incentive. There's just there's too many gaps.
my harm reduction team, when they're out and about, you know, it says needle exchange on the side of the ambulance, but that's a very minuscule piece of what we do. It started as a needle exchange, but it evolved into something much, much greater. Unlike a lot of harm reduction programs, we're not out there just offering syringes to people. If they don't have used syringes to give us for medical grade disposal, then we don't exchange with them. It's a one-for-one exchange. Mostly what we're doing is out there, you know, building relationships and mentoring and educating and providing naloxone and resources and just learning where people are at in their life and letting them know that somebody cares about them. And we get a lot of blowback from the community. They call us the drug ambulance, even though we have absolutely nothing to do with drugs except for recovery and harm reduction. We have a lot of negative comments on social media about how people don't like their tax dollars paying for these programs, and I can assure everybody in the world that we are a 501c3 nonprofit. We do not operate on government subsidies or taxpayer dollars. And what really costs the taxpayers money is when somebody uses a used syringe and contracts hepatitis C or HIV, and they're on Medicaid, and that costs the taxpayers hundreds of thousands up into the millions of dollars for end-of-life care, for eradication treatment, that sort of thing. So a 72-cent syringe might save the taxpayers $2 million in the long run. You know, if somebody contracts HIV and dies from it, or they need, you know, $30,000 a month treatment to keep the virus at bay. So really we're out there trying to mostly just educate and get people to begin engaging in a recovery lifestyle. So I would like to see a little bit more understanding from the local community about our harm reduction programs and about what Provoking Hope does.
We're working on it with HHS, with Lindsay Manfred and her team with respect to the COSs, those are the mental health crisis workers. But what I think our community really needs to do a better job of is like what Aaron and Jennifer's team doing, are meeting people in the moment, right? The warm handoffs, right? We can provide funding to many nonprofits or even government agencies, and we can wait for people to come to us. That's not the way. That's not the way we're going to address this community problem and this community crisis, in my opinion. We have to find ways to get those that are doing the work on the ground with the police, with Provoking Hope, with the nonprofits, to meet folks where they're at. It is so difficult to get folks to go through that door. And if we can find a mechanism, if we can find a team, a multi-discipline type team to go out and really work on those warm handoffs and getting people those referrals information. I find it ironic that there are agencies that are only taking applications through a computer portal. That's crazy to me. When some of these folks don't have that, it's like, how are we operating like this? It's insane to me. And I think if we can break down some walls, break down the silos that people live in or work in, we're going to be better off as a community and getting out there and really getting on the ground. Again, I would say that's the one thing I could see our community doing a better job at, is meeting folks. There's a lot of great work being done, a ton of great work. But until we meet people in the moment, until we do those handoffs and we walk people to make sure they're going through with their appointments, to make sure they're getting to what they need to do, I think we're banging our head against the wall until we start doing that at a really purposeful level.
Thank you. Well, I, for one, am very grateful for the work that all three of you do in our community, and I believe that I speak for the majority of our community that your work is appreciated and supported and necessary. So thank you all for what you've done. Thank you for being here today to share your stories with us.